All right. Hello, everybody. My name is Christa McCrorie, and thank you for joining us for our panel discussion today. Our panel is called Two Perspectives, Multiple Modalities, Integrating Care While Respecting Boundaries. So I'll introduce myself first. My name is Christa McCrorie. I'm a therapist in private practice. My private practice is called Creative Therapeutic Solutions, where I provide psychotherapy, sex therapy, life coaching, and I specialize in queer populations, trauma processing, and perinatal experiences. I'm also an instructor at the University of Alabama School of Social Work, and I'm a Fulbright specialist as well. And would you like to introduce who you are?
Sure. My name is Darren Cyrus. I am a licensed massage therapist and a certified sexological body worker. I have a private practice that is called Bare Soul Wellness.
Awesome. Well, thank you so much for being here.
Yeah, thank you for having me.
Yeah,
This will be fun.
yeah, I think so. We're both different kinds of professionals, but today we're going to be talking about our two different perspectives, different modalities, um, what's still working with care with clients that come to us for sexual function related problems.
Okay.
So,
Yeah.
mhm,
Oh,
go ahead.
so I am both a licensed massage therapist and a certified sexological body worker, but for the purposes of today, I will be speaking through the lens of sexological body work.
Awesome. Thank you so much. So our first question is and you can start with this one. How do our different modalities complement each other for a client?
Hmm. Well, when when I'm working somatically with a client and things come up, like in my practice, we don't go backwards. We are in the present.
Mm.
So when things come up for a client that ping to something in the past, yeah, it's really beneficial to be able to hand them off to a therapist and be able to address those things.
Yeah, yeah, and I agree from my perspective as a sex therapist and psychotherapist, we are usually using the tool of communication with each other to try to talk about not just what presently are the symptoms, but also the history in the past that's led to the manifestation of the symptom and future setting, goal setting towards the future of where they would like to be in managing the symptom. And I think another big difference between our two modalities is that as a therapist, my primary tool is communication, and it sounds like yours is more of a hands-on approach that I would it would be inappropriate for my profession to do.
Yeah, yeah, absolutely. That's kind of where they dovetail.
Mhm.
Um, Yeah, the focus of my practice really is touch and being touch based. I mean, there are scenarios where we would have to work up to touch, and then sometimes we don't ever get to touch. But there are embodied practices and somatic practices that we implement. So.
Mhm. Yeah, yeah. Thank you so much. Another question. Can you share some examples of where timing and sequencing of modalities matters in supporting the client's body, mind, and spirit?
Mhm. Um, yeah, time. Let me. Okay, so when a person comes in, like if they're just not ready for the work, then yeah, there's no point in even attempting it, right? They have to be ready. Like the timing has to be right in their lives. And then as far as like in session, um, I usually go in with a plan, but then I usually abandon that plan because things show up um, as they show up in session. So, I mean, there is kind of a timing and kind of a flow. There's like coming in and landing, and then depending on how long that takes, then we'll move into um, like body awareness, and then from there we may move in to touch. But yeah, I mean, the timing of it is just really variable. It all depends on the client because these sessions are client led.
Yeah, definitely. When I think about like a therapist perspective of the importance of timing and sequencing, I'm also reminded of the importance of meeting the client where they're at and staying with that client in their own timing and their own sequencing of how they would like to proceed with addressing the issue or addressing the symptoms that they're noticing. I think that being mindful of where the client's at is a big part of paying respect to the client and honoring the dignity and the autonomy of the client. And I think that if we were to ignore that client's natural capital S self-pacing in that, we're going to end up causing harm to the client and also maybe uh, feeding a power dynamic of the therapist as the authority on the situation, which is not true, which is not the case. So I think that's the timing is really important in honoring the client's spirit, I would say, in a way, the capital S self, their autonomy, their dignity. I think also too, when it comes to sex-related functioning, um, as a therapist, my primary tool is communication. There's not ever going to be a time where I'm going to physically touch my clients, but we might be talking about exercises that the client could do with themselves or with a partner, or maybe go to somebody like your profession to physically work through. And I think too, when we interact with people's bodies need time as well to heal and to change and to shift. And to gather safety. Sometimes, when we're talking about the trauma response as a nervous system response, it takes time to rewrite the nervous system's ability to feel safe. And we can't rush that process. So that's just another important thing that sticks out to me about the importance of timing when it comes to really meeting your client where they are and the timing aspects that are important to genuine healing in a client.
Yeah, yeah, absolutely. May I add something?
Sure. Yeah.
Yeah. So, when a client comes in, like typically they're rushing. So they'll kind of come in and sit and they'll be like erect and like ready to go.
Hmm.
And I just encourage them to like soften into the space, take a look around, maybe get up and walk around, see how you feel in different areas of the space, like really giving their body a chance to transition from traffic and doing and
Mhm.
coming in and just being and being in their body.
Mhm.
So I think one of the more important aspects of timing is like having actual time, like having enough time for their nervous system to go through that change and for them to acclimate to a new environment.
Yeah, absolutely. Absolutely. I think as maybe when I think back to myself being like a younger therapist, like a newer therapist, I think I was afraid to allow silence to happen or space to happen. Like I
Mm,
felt like I was supposed to get in there and fix it. And I feel like sometimes with clients, when it comes to their own advocating for their treatment, I mean, they're very motivated. I want to get in there and fix it. But yeah, I agree with your point of just kind of like the importance of building spaciousness and groundedness in I mean that's a even if it's like a not an active doing, it is you are doing something. You are acclimating to the situation and being present and being grounded.
yeah, absolutely.
Yeah.
Mm.
Well, our next question, let's see. How do you ensure, so from your perspective, your profession, how do you ensure boundaries are maintained given the multiple modalities that you practice?
Mm. Um, yeah, well, it is my job to ensure that boundaries are maintained,
Mm,
right? Like the client, like when they're kind of in it, like all types of things might come up. All
mm,
types of desires might come up. All types of requests might come up. And it's up to me to say, either like we didn't discuss that beforehand, so that will be like off of the table for this session, but we can discuss it for the next one. Or it's like that is like outside of my willingness or my scope of practice. So yeah, I'm a no for that. But having a really clear discussion about what is actually on the table for our session is important, and that happens at the beginning when like the client is in their sober mind, because once like touch and like somatic activities start, like the brain can get flooded with these chemicals that can actually alter their state of consciousness.
Mm.
So, and and my rule is that we can always do less than what we agreed to in the beginning, but we'll never do more.
Mm.
Yeah.
Yeah, yeah, that's really powerful. Yeah. Um, when I think about myself as a therapist, and I think about boundaries, I think of stating expectations is really important, and also allowing the client and encouraging the client to state their own expectations as well, so that we can both be on the same page and we can both proceed together, and so that we're both not violating each other's boundaries. I think a big principle in sex therapy specifically is how you go about the conversation of talking with your clients about sex. In sex therapy training, there's a lot of teachings about your first step is to kind of show to your client that you're a safe person to talk to about their experiences if they would like to, but you don't want to overstep and you don't want to start telling the client what to do, like in any aspect of therapy. But I think in sex therapy, it's also a really uniquely important thing to do. And, how to link up with your clients so that you can match them where they want to go in that conversation and how they want to utilize you as a tool, that you utilize the therapist as a tool so that you're not overstepping and telling them what to do, but you're not underperforming in the client's eyes of not helping them in a way that they're not feeling supported anymore.
Mm. Yeah. So, in sexological body work, just as a rule, sexological body work is like non-pathologizing. So, yeah, instead of like dealing with something as a disorder, um, we just like, this is where you are,
Mhm.
and would you like to change this, or would you like to explore this more deeply and find like possible pleasure here? And really, sexological body work is also client led. So, like figuring out where they are and what they want to achieve, like what they want to change, what they want more of.
Mhm.
Yeah, and operating from that perspective as opposed to this is what's wrong and I know how to fix it.
Mhm.
You know?
Yeah, yeah, yeah. That's just a really powerful approach. I think especially when it comes to the subject of sex, so many people's personal experience or societal internalized experiences is a connection with sex and shame. And so just very mindfully how each of us in each of our professions like approach that sort of topic and not pathologizing it and leaving space for curiosity and interest and pleasure and joy and all the things. I think that within itself is just a really powerful thing that some of our clients have never seen before.
Yeah, absolutely. Yeah.
Yeah.
We both do really good work.
Yeah, we're doing it. Yeah. Well, our next question, what strategies help clients understand what to expect from each modality and from each practitioner?
Would you like to take that one first?
Sure, yeah. So I think just what I was saying a couple minutes earlier of like, as the therapist, it's my responsibility to allow there to be a time and a space in the conversation where we talk about expectations. And I think that's also part of, I mean, it's honoring the autonomy and the dignity of the client to make their own choices and be an active part of their treatment. But I think it's also a big part of building safety with people is having a part of the conversation where we talk about expectations and how they want to utilize me. And also me letting them know, um, whatever they need to know so that they can make an informed a decision about how they utilize me as a tool. So I can tell them the kinds of things that I can help them with, or where we could go in the conversation, and they can kind of understand, making an informed choice of like how they would like to proceed, while I'm also actively guiding and exploring with them in the conversation too.
Yeah, beautiful. Same. Uh, um, yeah, it's like presenting information about what is possible first, then saying, what do you want to do? And typically, a client will come back with, I don't know.
Hmm.
And so then it's like, well, we can, just giving options and like even getting a sense of the client and giving options that I think are appropriate.
Hmm.
Um, yeah. So back to consent, it's like a yes, like is a yes, and no is a no. And in some circles, like people treat like maybe like a no, but to me, like a maybe is a call for more information
Yeah.
so that they can make like a yes or no decision.
Yeah.
So yeah, just really kind of like laying out the options, seeing where the client wants to go,
Mhm.
and then giving them options to support that if they're unclear, and just giving more information if there is a maybe.
Great. Yeah, yeah. As you're describing that, I'm just thinking like, one of the fundamental understandings of consent is that it needs to be enthusiastic. That maybe is not enthusiastic.
Yes, yeah, absolutely.
Yeah.
Yeah, I mean, you could have an enthusiastic maybe.
Like a curious, like, oh,
Yeah,
maybe, yeah.
yeah, exactly. And yeah, that maybe to me is just a call for
Yeah.
more information.
Yeah. Yeah. That is really well put. Yes.
Thank you.
Our next question. How do you know when a client's needs exceed your scope and require a referral?
Hmm. Um, if I'm not seeing a change, if I'm not seeing um, like a deepening of their understanding of their body and pleasure, um, if we're doing physical work and physically there's not a change, if they have something specific that they want to work on, like pelvic floor tension, um, or like vulvodynia, like feeling and seeing that there's not a change in that.
Mm,
Um, or if there's like a change, like a negative change, like more pain,
mm,
then it would be appropriate to refer out. Also, if a client is kind of like constantly going like backwards in their mind, if they're constantly referring things in the present to things that happened in the past, or if there's unresolved stuff from the past, then it would be appropriate to, yeah, kind of refer them to a therapist or sex therapist.
yeah. Yeah. That makes a lot of sense. I think of, as a therapist, I think of just how important staying in your lane is basically. And I think of, if my client is needing legal advice or medical advice, I'm absolutely not ever going to step into that. I'm going to be like, you should contact a lawyer. You should contact a doctor. I think too, I'm like just having the pleasure of getting to know you and like what you do as a sexological body worker. I think everybody could benefit from a sexological body worker. And I think that, as a therapist, there might be exercises that me and my client might be able to talk through for them to physically experience or explore themselves or something with a partner in a certain way. But I think, I mean, just hearing what sexological body workers do and how they can kind of help explore that even deeper and the depth of knowledge that you guys have about the body and how that relates to eroticism. Like, I mean, that's something that I think everybody could really benefit from. And, I think too about, um, you know, I think sometimes in the modern age, I think sometimes therapists are also kind of looked at as almost like how priests used to be looked at. And
Hmm.
I'm not a spiritual leader, right? I can use a lot of spiritual um uh affirming and we can talk a lot about existential type issues, but I do not have the spiritual answers for you, you know? And so I think also making sure that clients are connected to their bodies and supported to explore their bodies, whether it's with people that are friends and family and partners and people that are in their life, or if they need additional support or they don't have people like that in their life, going to other professionals that can do that with them. And also, I think a big part of eroticism for a lot of people is related to their spirituality as well. And so I think also having those spiritual leaning people in their lives that they can go to and that they trust and can explore deeper with them, or referring them to professionals that can do that as well.
Hmm. Excellent. Yeah.
Yeah.
Hmm.
Well, our next question, let's see. We have a case study.
Hmm.
So, we are going to consider a client who is postpartum, struggling with sexual desire, physical tension, and emotional stress. So in your line of your work, how would you approach this situation? And if you were also able to utilize a sex therapist, how would you also add that sex therapist into the mix as well?
Hmm. Um, First, I would like address the physical tension because the like when your body is tense, that influences everything.
Mm,
Um, so getting like working with their body, helping them get into their body, identifying where there's tension, releasing that tension, like gives them a place to like come home to in their body
mhm.
where like they can feel relief, not feel like the tension and restriction. um yeah, so once I address tension, then it would be um just a mm, like a slow exploration of like pleasure in their body.
Mhm.
So like pleasure mapping from head to toe. Um, yeah, and then from there, I would let the client lead and just kind of tell me what they want to work on, what areas they want to work on. Yeah.
Yeah. Wow, that's so powerful. I'm just imagining a postpartum client struggling with these different things we talked about and like how much of a gift that would be for them to work with you and you're almost like reintroducing them or re-engaging them with their own body. And just the way you described that just sounds really powerful. I
Hmm.
could imagine a lot of people in a similar situation really enjoying that.
Oh,
Um,
thank you.
yeah. Um, well, as a sex therapist, I'm gonna mostly focus on, I mean, I'm going to start a conversation about um, what their expectation is, right? So they're saying they're postpartum, struggling with sexual desire, physical tension, and emotional stress. I would probably ask them, what does it look like to get better? What does it look like to resolve these symptoms? Do you imagine it resolving or do you imagine it maintaining it? I think that, especially when we talk about a client who's postpartum, there are a ton of societal and individual expectations about what it is to be a mother. Um, and some people's, their understanding of being a mother is that these things are just kind of part of it. And so I want to maintain these things rather than resolve them. For some people, they might have another expectation, maybe an expectation that is not super realistic. I want everything to go back the way it was before I had this baby.
Hmm.
It's an unrealistic expectation, right? So I would probably first have a conversation with them about those expectations, like we've been talking in the other questions. I would also probably want to ask about some of their history. So their postpartum, they've had a baby recently. I would want to ask them about their postpartum experience, their birth experience, their pregnancy, their ideas of becoming a parent and how they got pregnant and started on this journey, and how they've been supported or not supported. I also think about the idea of how we carry a lot of stress in our bodies when we're not always offered an outlet to express that stress otherwise. So I would also kind of be exploring physically, are there ways that their body is being this container to try to hold these things when maybe there aren't other outlets anywhere. So anyway, I would just kind of be exploring a lot of different ways that this person's mind, body, and spirit sort of interacts with each other to see if any of these symptoms are manifestations of the mind, their history, their own expectations. Their own spiritual grounding right now. Becoming a mother and being fully responsible for a brand new human being is a very big deal. And it can be very existentially terrifying. So I think about that as well. And I would probably be referring them to a couple of professionals that could interact with their body in a way that I can't as a sex therapist. So I would probably encourage them to talk to their doctor if they haven't already about if any of these things are related to any physical needs in their body. And I would also probably refer them to somebody like you, where they can get all the things you talked about, because all the things you talked about sounds fantastic. And I would also probably kind of look at this client through an attachment lens as well. I'd probably ask about if they have a partner in their life, how are things going since they've had their new baby, or if their partner isn't involved and it's their family, the primary support people in their lives. I just kind of be exploring through an attachment lens how this all ties together and their bonding with their baby.
Hmm. Hmm. If I could add,
Sure.
yeah. So like the way that you would like communicate with the client,
Mhm.
I would kind of be doing the same thing, but it wouldn't be with words. It would just be directly through their body. So
Yeah.
like instead of like having the emotion or sensation, translating that into words, and then having a conversation, we would just go directly to where is the sensation in your body,
Mm.
and like, is it okay if I touch you there?
Mhm.
And then I do like just the presence of that can move emotion and move energy, sometimes in a way that they don't realize,
Mm.
like cognitively, but somatically, their body is moving this stuff.
Mm. Mhm. Yeah. Yeah. That's that's really, really powerful. I'm just reminded again about how much our clients need both of us, both of our types of professions at the same time
Yeah.
to address
Yes,
different things. I think they're just very complementary of each other.
absolutely.
Yeah. Um, well, I'm going to go to another question now, kind of moving towards closing our session today. I'm really enjoying what we're talking about. This is really good stuff. Um, So I would ask, what final advice would you give to other professionals, whether they're sex therapists or whether they're sexological body workers? What other advice would you give about integrating these different modalities that are at your disposal while also maintaining professional boundaries with clients?
Hmm. Hmm. Um, yeah, I guess the one piece of advice would be to like open up your perspective. Like find the value in these other professionals and other modalities. Um, yeah, try not to be so attached that like your way is the way to do it and it's the only way. But
Mhm.
there are like ways that all of these therapies complement each
Mhm.
other.
Yeah, absolutely. I would say the same thing. I think sometimes sex therapists or therapists in general, um, sometimes can feel I don't know, discriminatory towards other professions or other types of sexual support or bodily support. Um, and who knows where that comes from? It might just come from because we can't do that, and so it's hard for us to imagine how that works, just as a profession. But yeah, I would encourage sex therapists to continue to stay open-minded and actively seeking to build relationships with people in other professions that can help your clients in different ways. Um, and send referrals because, as we're talking through our case study and our other ways that we help our clients, we're helping our clients with the same thing, but we're kind of helping them access their healing at different angles.
Yes.
And it helps our clients. And so I would encourage sex therapists. I'm trying to think if there's anything advice that I can offer sexological body workers. Uh, I'm not totally sure. I just really respect the kind of work that you guys do, and I find it really interesting. Um, and yeah, I think just as there's a lot of separation sometimes between our true professions. So I would just hope that we our two professions just get more and more comfortable talking with each other and working together for the benefit of our clients.
Yeah, for sure, 100%.
Yeah. Well, we're about out of time. So I was going to give my contact information if anybody would like to contact me, and then you could give yours if that's all right.
Absolutely.
So, like I said, my name is Christa McCrorie, and my private practice is called Creative Therapeutic Solutions. I'm based in Birmingham, Alabama, which is in the US. And if you would like to contact me, you can email me at Christa, CHRISTA, McCrorie, McCrorie, at therapysecure.com. You can also call me at 205-578-2692, and you can visit my website, which is creativetherapeutic.solutions. Would you like to share your contact info?
Sure. So, again, I am Darren Cyrus, licensed massage therapist and certified sexological body worker. You can find all of my information at www.baresoulwellness.com. You can also find me on IG and Facebook at Bare Soul Wellness.
Awesome. Well, thanks so much for being here. This
Yeah,
was great.
thank you very much for having me. This was a lot of fun.
Yeah, thank you so much.
Okay, Krista, thank you.
Thanks.